Alcon is celebrating 75 years of eye care innovation and currently is focusing on the development of presbyopia-correcting IOL platforms. In that regard, we have two special guests here today with us. Dr. MJ Kim, founding director of Renew Seoul Eye Center in Seoul, South Korea, as well as Dr. Victor Loh, head of APAC Medical Affairs for Alcon. These two will share some important thoughts on, again, the development of presbyopia-correcting IOL platforms.
Gentlemen, welcome to the program.
Thanks for having us.
Thank you.
MJ, I hear that you actually implanted the first Clareon PanOptics in Korea. Congratulations, and please tell me about that experience.
Fortunately, I had a chance to use the Clareon, the PanOptics, before the official launching in Korea. And I was so excited to use the new platform. I was expecting various features of the new platforms, and as my expectations, the iOS result, surgical outcomes was excellent. So I am very satisfied with the outcomes, and I'm going to introduce my experience to my colleague surgeons in Korea.
It's great to hear. Thank you for that. MJ, which one of the Alcon presbyopia-correcting IOL platforms between APACRS Vivity, APACRS PanOptics, and Clareon PanOptics have you been using the most in your clinical practice?
I have used the APACRS platforms, the Vivity and the PanOptics, and I was very satisfied with the outcomes in my patients. Now in Korea, the Clareon PanOptics is available, and I'm using, in my most cases of PCIOL, I use the Clareon PanOptics now. So I'm waiting for the Clareon Vivity is launched in Korea.
Okay, that's up to you, Victor. So we look forward to the support.
We're definitely planning that.
MJ, how long have you been using these presbyopia-correcting IOLs in your practice?
I was not very convinced with clinical outcomes of the multifocals until 2008. I had a chance to do some of the researches on the optical properties of multifocal IOLs in the University of Rochester. After the research, I was so convinced with the multifocal IOLs function, and so I started to use the multifocal IOLs more. I would say that I was convinced by the optical experiment with the multifocal IOLs.
I'm glad the country where I'm originally from helped to support the research in that regard. MJ, based on your clinical practice, what are the advantages and benefits of the Alcon presbyopia-correcting IOL platforms you've been using compared to their competitors?
The platform of the Alcon is proven in the monofocal IOLs, and it provides the refractive stability and the rotational stability. So on top of the platform, the toric IOL was built, and also the multifocality was added to the stable, proven platform. So I think that's the strength of the Alcon's pipeline of PCIOL. Also, I like the optical design of the PCIOL of the Alcon. I think the balance, in terms of the multifocal design, the balance is important. Intermediate vision and the near vision should be enhanced while maintaining the distance vision. The other platforms are not balanced. Some of the balance is deviated too much to the near the vision, but PanOptics is very well balanced, so it meets most of the patient's needs safely and efficiently. That's what I like with the Alcon's platform.
It's great to hear. Thank you for that. And back to you, Victor. How does Alcon go about supporting data generation for these presbyopia-correcting IOLs?
Yeah, thanks for that question, Matt. As you know, Alcon is a company that's built on innovation, and part of the innovation process is to continuously do our research to make sure that we have the data that stands behind the products that we bring to market. So we do projects from corporate sponsored studies, which lead to product registrations, but we also support a lot of investigator initiated trials, which means when investigators or scientists like MJ as an example comes to us with an idea, we look at the ideas, we have a discussion, and if it's something of mutual interest to both the investigator and Alcon, we do support it in terms of a grant. So as of end of last year, we had about 85 projects in presbyopia-correcting IOL projects, and in Asia Pacific, we've got 26 current ongoing projects in the PCIOL space as well.
Now, Victor, what makes presbyopia-correcting IOLs like Vivity and PanOptix stand out in the market? And then I'd also like to hear MJ's opinion as well.
So if I just start with Vivity, it is a very novel and proprietary optical property that we are looking at in terms of the lens. So what it does is it basically stretches and shifts the focal point of the lenses. So it gives us a very nice broad range of focal points without the typical dysphotopsia or how should I put it? Without the usual glares and halos that most patients may complain with a diffractive type lens. So that's something that we are very excited about in terms of bringing Vivity to the market.
PanOptix is very well known even to the public, not only to the doctors. By means of kind of words of mouth, the people are already know much about the PanOptix, and they know that their life can be enhanced or facilitated by the PCIOL. That's a good thing, but the PanOptix is not for all the patients. And if the ocular surface is healthy and the cornea is regular and the macula is also healthy, and the PanOptix can be recommended. But with some the comorbidities, such as the epiretinal membrane or the dry eye, the poor corneal quality, and the PanOptix is not proper for those kind of patients. And then the Vivity is more forgiving characteristics, so the Vivity can be a good option for those kind of patients. The PCIOL market is growing very fastly, I think.
And MJ, which one of the properties of these presbyopia-correcting IOLs convinced you to use it in your practice instead of other similar available products in the market?
I see the advantages of the platform first. As I mentioned earlier, the refractive outcome is excellent, very trustworthy, and I can trust the platform, and the optical design is very well balanced to maintain the distance vision, and also it provides good intermediate near vision, which the overall satisfaction rate of the patients is very high with the current version of multifocal IOL.
That's great. And Victor, do you also agree that those IOL properties are critical?
I think, we are always here to listen to the expert surgeons because they get the feedback from the customers, and certainly feedback from the patients through the surgeons is very important to us, and certainly we always want to explore what the surgeons are telling us. And back to the point that MJ made earlier about patients who don't have ideal or pristine eyes, that's exactly the sort of data we are collecting through the Vivity registry. So we'll get more and more data to show that, as MJ is mentioning, it's a little bit more forgiving in these sorts of patients. So that's our commitment to helping the surgeons.
And Victor, what other areas of research is Alcon supporting?
Yes, so Alcon, we are a very large eye care company. So broadly, we have the surgical side of the business, and we also have the vision care side of the business. So certainly under my team in medical affairs, we are supporting a whole range of research projects on the surgical side in terms of equipments, our lasers, our intraocular lenses. And on the vision care side, we are doing studies in contact lenses, contact lens care, but also the eye drops to help manage dry eye. So certainly the whole spectrum of Alcon products, that's what we are supporting.
Excellent. Back to MJ, in which type of patients would you recommend the Vivity? In which type of patients would you recommend PanOptix?
I ask the patients about the lifestyle. If the patient have to drive nighttime, the dysphotopsia can be the barrier to recommend the PanOptix. For those kind of patients, I recommend the Vivity. Also, the PanOptix is a little less forgiving. Everything is good. The surgical outcome is excellent, but the ocular condition doesn't permit the PanOptix as an example, the dry eye and the cornea, the pathology, and the pathology in the macula. And then PanOptix is not the best option for those patients. So I would recommend more forgiving Vivity for those patients.
Certainly, we are hearing very similar comments from the surgeons, but I think we need to appreciate that every surgeon has a different level of comfort with the different new technologies, and certainly every surgeon has perhaps a different cohort of patients as well. Let's take an example, a surgeon who works in a tertiary center who may get a lot of patients with, altered corneas, a lot of comorbidities. So it's hard for us to really generalize, but broadly speaking, what MJ is telling us certainly is very consistent.
This is 21st century, and the patients want to be more benefited by the new technologies. And if the ocular condition permits, the PanOptix would be a good option for them. But some of our ocular conditions doesn't permit the diffractive IOLs, and then we have good options, which is Vivity, and because it is more forgiving, and it can be a good option for them.
Victor, do you agree that proper patient selection is important for these IOLs?
Definitely, and that's where we rely on the expertise of the surgeons to ensure the appropriate products for the right patients.
Alcon recently celebrated 75 years. Congratulations. Can you share a little more about this, Victor?
As you mentioned, we just celebrated our 75th anniversary, and since the founding of Alcon, we have always been a very innovative company. So things like the drop thinner for all our eye drops that we are all familiar with, that was an Alcon innovation back in the 50s, all the way to the whole range of intraocular lenses, surgical equipment, contact lens materials. That's something that Alcon has always been innovating since our founding many, many years ago.
Incredible heritage for sure.
Yeah, but not just the heritage, we now want to start looking forward as well. So that's why we don't stop innovating. We want to continue our innovation. And in 2021, as an example, we spent more than $800 million on our R&D function to help to continuously generate newer and newer innovative products that, perhaps MJ would be using in the not too distant future.
MJ, can you share some real clinical experience of your patients who have had these presbyopia-correcting IOLs?
Near vision with the Vivity is variable in every patient. Some shows very good the near visual acuity without these photopsias. One of my patients is so satisfied with the Vivity IOL's outcomes, and he brings coffees for my staffs every visit.
Wow.
So I am very thankful the gentleman. So I understand his life has changed with the Vivity IOL implantation. That was very impressive to me. With the PanOptix experience, the patient came to my clinic with the implantation of the other platform multifocal IOLs, and the patient was very satisfied with the distance vision. The near vision was okay, but the distance vision was very foggy and dissatisfied with the outcomes. I decided to exchange in one eye. I implanted the PanOptix. After the exchange of the IOL, the patients got happy with the new IOLs. That was also the lesson I learned from the PanOptix use.
It's great to hear those success stories. Now, MJ, what type of feedback did you receive from your patients after IOL implantation? You shared a little bit there. Are there any other stories or any other anecdotes or evidence that you'd like to share?
When the patients come into my office, I see the face first and do the eye contact, and I can notice that how the patient is satisfied. And with the Clarion PanOptix introduced in the market, I see more the smiles on the face of patients.
Yeah, that's great interpersonal interaction. I'm so glad to hear about that in Korea. That's wonderful. Are there any other ways that you monitor patient outcomes in terms of how happy they are? Any other ways that you would characterize that?
Some people express the change in the life as a whole new world. because preoperative life was so disturbed by using the different glasses, like 4 or 5 the glasses. The life with the carrying the different glasses is so disturbing. In the age of COVID, they have to masks. On top of the mask, the wearing the glasses were, I can imagine how hard it was. With getting the freedom from the glasses, their life has changed a lot. That's why they express as the whole new world. I fully understand that.
It's a great way to express that. Thank you. And finally, Victor, can you share some of Alcon's efforts in the underserved areas of our communities?
Thanks for that question, Matt. So on top of being innovative and bringing great products to market, a big part of what Alcon does is on the side of corporate social responsibility. So we do know that there's a lot of the world that doesn't have access to surgical equipment, lenses, and the such. So Alcon has got a phaco development program, which over the last 14 years, we have trained over 5,500 surgeons in low to middle income countries, and they have performed more than 7.5 million cataract surgeries. And as MJ would know, that can be life-changing for a lot of these patients. On top of that, we also partner with Orbis. So we have been doing so for the last 40 years. So we have been donating in terms of financial contributions, but also we send our engineers to do training, we provide equipment, we provide consumables, and that's also something that we are very proud of as Alcon, to be able to help the underserved access to better healthcare, and ultimately we want to help them see brilliantly. That's what we are here for.
It's great to hear. I recently became a board member of Orbis Singapore, and I didn't realize all of that. So as a new member, I want to thank you very much for that.
Thank you.
Gentlemen, thank you for joining the program today. You've expressed some wonderful things about these IOLs. The community appreciates it, and we appreciate your time.
Thanks, Matt.
Thank you
MJ.
for having me.
All the best.